Good afternoon and welcome. My name is Deb Cunningham and I'm the Director of Strategic Partnerships for the Aspen Ideas Health Program here at the Aspen Institute. And on behalf of all my colleagues, welcome and thank you for joining us. We wish we could be together in person in Aspen, but until it can be done safely, we'll just continue to host informative and inspiring virtual conversations like these between leading health experts, advocates, practitioners, scientists, innovators. Today, we're thrilled to be hosting this conversation between Webb Sun, co-founder and president of Komodo Health, and Dr. John Torres, medical correspondent at NBC News and MSNBC, about the important role of data science in helping to better understand patient behaviors. So let me properly introduce each of our speakers. Webb Sun oversees operations, including business development, sales and marketing, and people at Komodo Health. Prior to founding Komodo Health, Webb was a managing director at Zephyr Health, a leading life sciences data and insights solution provider. He also spent nearly 8 years as vice president at Campbell Alliance, where he advised enterprise life sciences companies on corporate development, brand management and marketing, commercial effectiveness, and other medical affairs initiatives. Dr. John Torres is an NBC News and MSNBC medical correspondent and an emergency room physician. His reporting covers a wide range of health-related issues across all of NBC's broadcast, cable, and digital platforms. Dr. Torres is a self-described Air Force brat. I would never call him that. He's a graduate of the Air Force Academy and is a veteran of the United States Air Force. And throughout his career, Dr. Torres has made numerous humanitarian trips to Central and South America, providing medical care to children in need. I'm sure he's a very familiar face to many of you, and he certainly is a longtime friend of Aspen Ideas Health. So a final thanks to our speakers and to all of you for Zooming in today. And with that, the floor is yours, Dr. John.
Great, and Deb, thanks for the introduction. And I particularly want to thank Webb Sun for being here for the discussion we're going to have here about the important role of data science and understanding patient behavior and helping to guide public health decisions. But I also want to thank the Aspen Ideas Health for having this. Even though in the midst of the pandemic, we can't go to Aspen, which is obviously the ideal place to be for these type of forums. Getting it virtual, getting online is certainly going to make a big step forward in getting the understanding out there for what we need here. And again, there's the important role of data science and understanding patient behavior. And we've seen over the last few months just how important that role is to guide public health decisions as well. So Webb, let's first start by talking about the pandemic and the significant decline we're seeing in routine care and screenings we saw during the lockdown. And I know one statistic a lot of people throw around is 32% decline in cancer cases, which on the surface sounds like great news, but when you start digging down, it turns out not so good news, because a lot of that is because these things aren't being detected. And as a physician, I can tell you, the sooner we detect them, the sooner we start treatment, the more successful that treatment is. So start talking about the pandemic and that decline in care and screenings that we're seeing.
Absolutely. Thanks, Dr. John. And echoing your comments, wanted to thank Aspen Ideas for the opportunity to speak today. I'll start by saying exactly where you started off. You know, a lot of patients have this perceived trade-off that they're managing, where they're balancing risk of COVID exposure with their need in order to get the care that they need to manage either diseases they may be worried about, you know, family history, et cetera. And so, you know, when we look at that, you have that balance, which is precluding many patients from going to see their physicians either for preventative care or, you know, preventative screenings. And, you know, that for us is the harbinger of potential downstream and future effects to the healthcare system that, you know, are unforeseen today. When we think about it, there's a tidal wave of potential pandemic ripple effects, ranging from the delayed and deferred preventative care all the way to observations we're seeing around socioeconomic barriers to care. And that is building up with each passing day and threatening to create an entirely new set of public health challenges, you know, that few healthcare professionals are beginning to contemplate, given that everyone's focus in the near term has been on the pandemic. And so you referenced oncology, you know, looking at oncology alone, to your point, you would say, oh, you know, we have lower cancer rates, but what we're actually observing is a meaningful drop in screenings, a meaningful drop in diagnoses, and all of that being a harbinger of potentially not only a surge in cases later, but more importantly, a surge in later stage diagnoses in the coming years.
There was a country lockdown, March, April timeframe, and everything locked down, including doctors' offices, including hospitals. And the message was actually sent out: don't go to your routine screenings right now. Wait until we reopen and COVID improves. Well, we reopened, COVID improved. Are we seeing an upswing in people going back for those screenings, for going back for those routine examinations?
What we're seeing is exactly what we're focused on, at Komodo Health, because what we're seeing is not only is there variance across the country, but we're also seeing variance within geographies. And then, as a lot of people have been observing around potential second wave, we're seeing different parts of the country locking down, opening up, thinking about re-locking down. And there's good reasons for this, but that's part of what we're essentially built to assess, which is what is happening on the ground in real time across the country, across the population, because that kind of insight is what is needed in order to inform and shape, whether we reopen or not, and in which parts of the country it's safer to do so or not.
And in some of these cases, there's the routine care, there's also the screenings. In some of these cases, the screenings or even the oncology type care situations are happening in people that are at higher risk. And so they had that perceived trade-off where they looked at the risk of COVID exposure to get the care they need or to prevent or even treat their cancers versus the need they had for that treatment or that screening exam. But even now, a lot of patients are still avoiding those healthcare facilities. Besides, despite being reassured from providers and myself on air, I'm constantly assuring them that healthcare facilities tend to be the safer places you can go to, that routine care and screening should not be delayed. What do you see as a path forward to better balance those health behaviors, to get people back to what we were doing before and realizing it's going to be okay in instances to go ahead and get those screenings, those examinations?
Yeah, I think part of it starts with having patients understand the real risk of not seeing their physicians and not engaging with their providers. And so, for starters, when you look at it, I don't think a lot of patients look at asymptomatic diseases like type 2 diabetes or, hyperlipidemia and say, oh, I feel this very acutely. I have this pain that's very acute. Therefore, I'm going to go see my provider. What we need to help educate the community on is the fact that, when we're seeing observations like blood glucose testing for diabetes and lipid panels screenings being reduced year over year by, in some instances and in some parts of the country, over 65%, helping patients understand that, you will be at a meaningful higher risk of an MI, of a stroke, or some other cardiovascular event. These are the kinds of things that have always presented challenges to providers. Now you layer on the additional risk where patients are doing the risk reward benefit assessment on whether or not to go see their providers given the risk of COVID. And I think, helping them understand the types of precautions, the actual risk, as well as, if you look at the actual mortality numbers for COVID vis-a-vis what happens if you don't have an intervention or if you don't get diagnosed early enough for colon cancer, what the implications on, your 5-year survival rate will be as a patient.
It's interesting because in the ER field, one of the things they've noticed is that the heart attack patients aren't showing up, the stroke patients aren't showing up, which doesn't mean that people aren't having heart attacks or strokes.
Exactly.
What it means is they're not going in and getting those screenings, and that can have huge long-term implications. Do you see that improving over the last few months, or is that something that is still a continuum from February, March timeframe in the lockdown?
Yeah, we see it improving over time. And going back to that exact point, let's say we look at colorectal cancer as an example. This is the second leading cause of cancer death in the US, but it's very survivable, as we all know, if it's caught early. Now, catching it early means getting the screenings, seeing your providers. And if you catch it early enough, colon cancer is very, very manageable, very survivable. You look at 5-year survival rates when caught early enough of over 90%. Now you look at patients that are delaying screenings, delaying testings, and to your point, delaying actual surgical interventions that can be life-saving for many of them. If we're catching these patients now in more advanced stages colorectal cancer, all of a sudden the 5-year survival rate falls to 14%, right? These downstream implications of not having your disease managed or not having your disease diagnosed early enough are very real. And to your exact point, we need patients to be going in and getting tested, getting screened, getting treated.
One of the things that COVID-19 and the pandemic has done is it has really amplified these discrepancies in healthcare across the country, and especially in areas where people of color live or people who are impoverished live and they're not getting that healthcare that other people are, or other areas are. Has that been amplified when it comes to these screening examinations, these treatments for cancer in particular?
Unfortunately, Dr. John, the answer is yes, because there's been a lot of excitement for decades now around telehealth. And there's been a lot of excitement through the pandemic around, massive increases in telehealth utilization. And we're seeing this in our healthcare map. But even with telehealth, arguably one of the bright spots of COVID-19, and where we're seeing the forcing function in terms of leveraging new innovative modalities for care delivery, what we're also seeing is very meaningful gaps in utilization. When we looked at nationwide data in telehealth use, we found a direct correlation with income. And specifically, we saw that healthcare providers in the top 10% of US counties with the highest median income were nearly twice as likely to offer telemedicine than those in the bottom 10% of counties by median income. And that is a very stark reality that the less fortunate face in trying to navigate their way through the pandemic. And yet another example of how, whether it's mental health, which we know can be managed through telehealth, or other conditions, this is something that is needed for the population at large, yet largely unavailable in many parts of the country.
Do the same factors come in based on age? Because I know that if you're in your 20s, 30s, 40s, it's easier to get on these telemedicine platforms than if you're in your 70s or 80s.
Yeah.
Do you notice any discrepancies there?
Anecdotally, we've observed it, but that is something that our team will definitely look into coming out of this meeting, because that's a very good observation. We've heard anecdotally from friends in the health tech community that have telemedicine, telehealth companies, and certainly there is a sort of technology barrier for some of our more elderly patients, but we have not examined that in detail.
And Webb, data drives science, or at least should be driving science, which should be driving our healthcare decisions. And for years, people have been saying that data is the new currency in healthcare, meaning it's extremely important. COVID has really brought that into focus. The pandemic has. What lessons are we learning from COVID as far as tracking and management that can be applied and pushed forward more broadly to our healthcare system?
I'll start by saying we need science and we need data to shape our response to the pandemic. We need reliable data that's timely, accurate, and representative of real-world patient journeys, what we refer to at Komodo Health as the ground truth regarding what's happening in healthcare, that we surface through our healthcare map. So much of the data around COVID, as one example, has become politicized, has become subject to interpretation based on where it originates. And for us, it's really just further evidence that we need a trusted single source of truth that can become the foundation for understanding the full scope of the pandemic and all of the interventions we need to put in place to manage it effectively. I think the worst thing we can do right now is let anecdotal examples or hypotheses rooted in incomplete or inaccurate data guide the public response to this crisis. And I did want to add, I'm personally inspired to see initiatives like the Atlantic's COVID Tracking Project. So many healthcare professionals and public health officials are recognizing that in the absence of government leadership through this pandemic, there will be an ever increasing need for initiatives like these to make hard data available to those responsible for studying and shaping our response as a nation. And in parallel, going back to the earlier comment you were making, as we look at systemic inequities at all levels in the United States, it's great to see the COVID Tracking Project tackling racial disparities resulting from the pandemic, as it's clear it is not affecting all communities equally.
And just let everybody know, in a few minutes, we'll be taking some questions from viewers. So if you have any questions, please forward them. You should be seeing the way to do that in your chat box here. But there have been a lot of challenges in terms of tracking data through COVID. And honestly, pandemic has hit us all so fast and so quickly, and this is something we've never gone through in our own lifetimes. And so we're going to learn lessons as we go along. Arguably, we haven't been learning the lessons as quickly or as readily as we should have. So what are some of the fundamental hurdles to make sure that we get reliable and timely views of disease in our country?
You know, the healthcare industry, as we've all observed, is siloed into many discrete fiefdoms, each with their own rules, legacy ways of doing things, and incentive structures that sit at odds with one another. That starts with the way disease is diagnosed and treated, and it carries forward to the ways individual encounters with the healthcare system are cataloged and tracked. The net result, has been an incomplete picture of the patient journey through the healthcare system that has stifled our efforts and our ability to better understand and holistically define and treat disease, from the individual patient, starting with them, all the way through to population level views. I think you can see so many examples of failed attempts to harness patient level data, which have included, the unrealized potential and promise of electronic medical records. Everyone's been talking about EMR now for decades. The over-reliance in many instances on single payer data sets and on aggregated claims data sets. And all of these contain incomplete, inconsistent, or outdated information, oftentimes on a narrow sliver of the patient population. And it really just spotlights the pandemic, given its reach, given its impact across the entire country, has really just spotlighted the lack of one place for us to go to understand and have trusted data available to analyze that will allow us to have an informed view in shaping the response to the pandemic.
And Webb, I don't know if you have an answer to this question, but is that a US specific thing, this fragmentation of the data and information system throughout the healthcare in the country, or is that something that's more widespread globally?
Sadly, I would say for the most technologically advanced society, as well as the one that spends the most money on healthcare, I would say we are in the unique, unfortunate position of we should be setting the bar higher for ourselves.
You've teamed up with the colorectal cancer advocacy group, Fight CRC, to evaluate how the pandemic is impacting cancer care specifically, because of the importance behind that. The whole world right now is focused on COVID. Why did you focus your attention on cancer care? What have you learned, and how is that data being used to improve patient outreach and communication?
In addition to some of the statistics I was citing earlier around survival rates for colorectal cancer, it's important to realize that the long-term significance of COVID as a public health issue stems not only from the virus itself, but also its ripple effects. The unprecedented response we've observed in combating the pandemic with stay-at-home orders and the sustained fear that many people have around engaging with the healthcare system right now is creating a whole range of problems that could ultimately cause much more harm than COVID itself. When you look at our research with Fight CRC, you see the number of colonoscopies performed fell 90% year over year, April 2020 to April 2019. And that's a problem that could reverberate throughout our healthcare system for years to come. You compare those numbers to the mortality rate for COVID, and I'm not downplaying, the importance of aggressively responding to COVID, but it does illustrate how mindful we need to be around the other areas of healthcare and the other patient populations that are being affected by the pandemic, both now as well as in the future.
And you brought up a good point about data systems and how the US is arguably one of the most technologically advanced countries in the world. Yet from what I've heard, some of the developing countries have better infrastructures and better systems around their data than we do here. Are we playing catch up? Is that what the pandemic has essentially, the lesson it's taught us, or one of them?
I draw the analogy to subway systems. When you're starting from scratch years down the road, you may be playing catch up, but you have no, what our engineers refer to as sacred cows from a legacy architecture, a legacy technology point of view that have to be preserved or transitioned. You can draw that parallel to what we're observing in our healthcare system. We have a lot of sacred cows that are being preserved, when in fact what we need is transformative thinking around how we take the technology that's available to us today, take the data that's available to us today, bring it all together so that we have a one, robust view of what's happening in our healthcare system overall. Again, ranging from the population health level all the way down to what's happening to individual patients.
We're getting a few, actually quite a few viewer questions here. Let me go to one of them here. Are you tracking data on vaccines? And if you are, what are you seeing both for childhood vaccines that could be delayed because of the pandemic? Your parents are obviously nervous.
Yep.
And also in terms of the outlook for the adoption of the COVID vaccine.
Yep. So with respect to pediatric immunizations, as someone who has a 6-year-old, a 3-year-old, and now a 2-month-old, I had to do that risk reward assessment, and I brought all 3 of them in for the flu shot yesterday, as well as the 2-month shots. I will say, broadly speaking, the required vaccines that kids need to have before attending school, we were observing 50% decreases year over year through April of this year, and that's only begun to rebound. Dr. John, you would actually probably have better visibility into what's happening with respect to the COVID vaccine and development programs there. But as far as currently available vaccinations and immunizations that are taking place in younger patients, just like what we're observing in adult populations, elderly populations, the drops year over year are very meaningful.
And with the COVID vaccine, the race is obviously heated up. It looks like we'll be getting one. Most experts are saying beginning of the year, maybe springtime, but that vaccine hesitancy is real and it's being more amplified as the weeks go on. So hopefully that gets better under control. But let me ask you this next question. Do you have any data to show that remote alternative approaches, telemedicine, different ways of doing it virtually to cancer screening could actually help? Is the increase in telemedicine reaching populations effectively?
Yeah, this is exactly what I was alluding to when I say we've observed improved patient outcomes in specific conditions like mental health, where telehealth has proven to be very successful and has offered a very compelling alternative. At the same time, when you're talking about a colonoscopy, there are certain disease areas, there's certain conditions, there's many screenings that require in-person visits, and that's not something that telehealth is equipped to address today. And unfortunately, that holds true in many disease areas that require earlier intervention, earlier diagnosis, et cetera.
And you brought up a good example of telehealth and telemedicine and how it might have some hurdles to go over. And part of that is especially in remote rural areas or areas where there are, the more impoverished areas, they might not have the infrastructure, they might not have the laptops, the high data internet to be able to do this. How big of an issue is that here in the US?
I think that, going back to the telehealth observations we're making, when you can draw a direct tie between median income and telehealth utilization, that presents a challenge to us as a country, right? Because if that is the only available option, and that is the option that has proven to be successful in certain patient populations, certain disease categories, then it is incumbent upon our leadership, our healthcare leadership, our policymakers to ensure that that is an available option. It starts with them and then obviously trickles down to payers and medical directors and provider networks then making it available as well.
Another viewer question here. This is a great question. The public health understanding, and this is something I wrestle with always, is the public health understanding of science has been a challenge. And oftentimes, researchers, scientists, they talk at a level that's a language of their own that oftentimes doesn't translate down to a level where most people can understand. How do you think data scientists, public health experts, medical professionals, even me in the media, those of us in the media, how do you think we can do a better job of presenting that data?
That's a great question. I think if I had the answer on how we do medical education across census, we would be in a much better place. During the entire 25 years I've been working in or around healthcare, that's always been a challenge, right? You look at asymptomatic disease areas, asymptomatic conditions, and patients don't do what doctors ask them to do. And frankly, many doctors don't do what they advise their patients to do. And so, I think even if data is more readily available, even if the insights we generate off of the available data are more robust and more trusted, we will still be faced with that challenge, as people in healthcare, with ensuring that, the population at large, is working in concert to address things that are more broad reaching like the pandemic, and also to help manage their own conditions individually.
And I talked about vaccine hesitancy and the fact that the confidence in our public health experts is waning a bit because of kind of cross information that's being put out there. Sometimes that information is put out there because studies will come out, and these are preliminary studies. And what I say is that in the past, if you looked at the way studies were done, they'd go on for 10 years with nobody hearing about it. And at the end of 10 years, after they've gone through 40 different studies, they come up with a finding, and that finding is what comes out in the media. Well, that curtain's been open, and now you're seeing these studies happening real time in media, and that can be confusing for people. How can data help that?
How can data help that is one question. One thing I'll also say is, I look back at what was published in JAMA in May regarding the need for reliable data. And it's interesting because even in that op-ed where they were talking about Vice President Pence requesting all hospitals to email key COVID testing to the Department of Health and Human Services, even with regard to that very specific request, reporting was made optional, partial reporting was allowed. It was unclear what elements of the requested information were actually being collected and how the data would be used. And so to your exact question around data availability, whether or not the data can be trusted, this is part of the reason why, our mission at Komodo Health in reducing disease burden entails bringing together thousands of different disparate data sources, data principles, and using technology and software to bring it all together and understand the unique patient journeys of over 320 million patients that are touching the healthcare system. That's a massive challenge, and for us to do that effectively requires us to use data sources that we can trust, as well as use technology to bring it all together and analyze it.
And that trust is important, and we're seeing that play out as the months go on here. A couple more questions. We're entering our second wave, or what some people are calling a second wave of the pandemic, as the cold weather hits. So it can be assumed that improvements that people have made in access for these screenings and testings is going to be reversed to a certain extent. How can we use data to kind of track people to find out, okay, you started going to a screening test, but you never did? How can data help us with that?
Great question. This is where the breadth, the depth, and and addressing the speed of the insight is so critical, because what we observed, going back to our earlier part of our discussion, what we observed is that across different parts of the country, across regions, even within regions, our ability to see what providers are picking activities back up, what providers are solely telehealth these days, what providers are starting to see patients in person again, and what types of tests, screenings, interventions they're delivering to their patients. Our ability to see that in real time, both the upswing as well as when activity was decreasing across all these different parameters, that's been so key to helping us help our clients on the government side of things, on the payer side of things, as well as on the enterprise life sciences side of things, understand not only the trends, but where you can actually make a difference, where you can actually intervene, where you can actually help with care delivery and care management. All of that is reliant upon understanding what's happening and how the trends are playing out literally on a zip code by zip code basis across the entire US.
And real quick, last question, you only have a few seconds here. With home screening tests coming to market, can data science be used to coordinate with health insurance plans to get tests to hotspot areas where communities really need them?
The answer is yes. If you know what's happening to patients, if you know which patients are likely to be at higher risk of condition ABC, there's absolutely ways that, even today, we deploy our algorithms atop our healthcare map in order to help predict where disease will emerge, predict where patients are more likely and require earlier testing for certain conditions. All of that absolutely is part of how data science can make a difference in terms of predicting disease at a population level, as well as for higher risk patients.
And Webb, I always like to end with hope for patients and kind of a bottom line. So what would you tell viewers?
I would say the increased data liquidity in our healthcare system, the increased focus on the need for trusted data sources, coupled with the massive advancements we're seeing in cloud computing, in compute power, all of these things coming together are going to create so many new opportunities to improve patient management, care delivery, and also, to diagnose earlier and treat earlier. And so I am hopeful and confident that this will result in continued improvements in delivery of standard of care, continued improvements in patient quality of life, and longer high quality of life living standards for Americans.
And as I always tell everybody, we will get through this. We will get through this together, but we need to make sure we're working together to get through it. And hopefully everybody, as best you can, please stay happy and please stay healthy. Webb, thank you very much. And again, Webb Soon, co-founder and president, Komodo Health, helping us understand a little bit more about data, its importance, especially as we go forward in the pandemic. Deb, thank you very much for hosting this here and introducing us. And Aspen Ideas, thank you for having this forum. And hopefully next year, Webb, you and I can maybe elbow bump, or hopefully even at that time, maybe shake, we'll see. And hopefully we get to meet in Aspen for the Aspen Ideas Festival.
I hope so. Everyone stay safe and thank you.
And most importantly, thank you guys for watching and for your questions. They've been fantastic. Have a good day.
Take care.